Sudden cardiac arrest hits roughly 1,000 Americans every single day and is almost always deadly unless there is help nearby. What makes it even scarier is the attacks seem to come on without warning. But now a recent study shows us there may be some warning signs after all. Here to tell us more, as well as what to look out for, is WSJ's Ron Winslow. Ron, thanks so much for being with us.
Glad to be here.
Tell us about this study. How many cases of cardiac arrest were analyzed?
So this is a study that is done in the Portland, Oregon metropolitan area. It's been going on for 14 years. In this particular part of the study, looked at a little over 800 cases of sudden cardiac arrest, found that in 430, or just about half of the cases, there were actually symptoms that could have been recognized, perhaps been acted on, that happened as early as 4 weeks prior to the event.
4 weeks prior. And so tell us, what are these symptoms? What should we all be looking out for?
I mean, they're pretty much the classic heart attack symptoms. There's shortness of breath, especially prominent, more likely in women than in men. There's chest pain, more likely in men than in women, neither one exclusive.
Right.
Palpitations, sort of a fainting or lightheadedness called syncope, might pass out. Mm-hmm. You know, and then you look at those on a sort of a list, you say, well, of course you might respond, but these symptoms are also common to a whole lot of medical conditions, some that are serious, some that are trivial or not serious, and exactly how patients should react, how, you know, what is the right trigger for prompting help, a call for help is not always obvious.
It's not always clear, but so then who are the people who are most at risk for sudden cardiac arrest? Will that help us sort of zero in?
Well, that would certainly, I mean, anyone who is already diagnosed with heart disease would certainly be one. Mm-hmm. I think people with heart defects that are born with heart defects may have electrical issues in their heart that could lead them to this. People with heart failure. So they're, the most prominent ones would be people who already have a history of heart disease.
Right.
But, you know, in some cases it comes as a surprise.
And what is different about a sudden cardiac arrest versus a heart attack?
Right. They're often used interchangeably, but it's not quite accurate to do. Sudden cardiac arrest is really an electrical problem in the rhythm of your heart that causes it to sort of go out of control or get so rushed so much that it can't beat regularly and it just stops. A heart attack is caused by a plumbing problem. It's in the blood vessels that feed the heart where there's a blockage. Now, a blockage can lead to a sudden cardiac arrest because if it's a very major heart attack, that can set off the electrical
And tell us
problems.
again why time is of the essence here. Your subject, tell us about the subject of your piece. She illustrates this perfectly.
Right. There's a woman named Sue Klebeck who I talked to who was out for a morning walk with a friend. She looked at her friend and said, you know, I must be dominating the conversation because I'm really out of breath. Didn't really recognize what that was. She got home, had a few episodes of chest pain. She looked it up on Google.
Thank goodness she did.
Well, yeah, but then she said, you know, I mean, I'm in pretty good shape, but I'm a healthy person. She was 50 years old at the time. She said, I can't be having a heart attack. And she had another one. She got herself to the hospital, walked up to the clerk at the emergency room desk, who asked, why do you think you're having a heart attack? And she was out.
Oh my gosh.
And so they had to revive her with had to shock her back.
And doctors say had she been even a few minutes later, she wouldn't have made it?
Just a second. You know, on her way, she drove, and you're not supposed to drive, really. You're supposed to call 911. She drove herself, had her last bout of chest pain, a block from the hospital at a red light. She ran the red light. And if she hadn't done that, she might not be with us.
All the more reason to pay attention to those symptoms and err on the side of being safe rather than sorry. Ron Winslow, thank you so much for that.